All
Yeah, I
right,
can
I
hear
think we're
music.
live. We'll give just a minute and see if we get anyone joining us here. Let the announcement go out. We're live.
Oh, yes, here we are. I can see it.
Yes.
We're on Facebook, everybody.
Oh my goodness.
Where is it?
We've made it to the Book of Face. Isn't that what you said?
The Book of Face.
Yes, you're on the Book of Face.
Yay.
What's wrong?
We're still trying to find us. Oh, there we are.
Okay.
We are
Perfect.
good.
All right.
Yes.
We are good to go. We ready?
And here we are.
All right, here we go. Hello, everyone, and welcome back to Middle Ages, our second live. I'm Trisha Kennedy Roman. I'm joined here today with my co-host, Ashley Bodowski, Lisa Kelly, and Dr. Pam Wright. And we are joined by Dr. Karyn Staples. She is a wife, mother, and physical therapist, and a nationally certified Pilates teacher, a business owner with over 20 years of clinical experience and teaching experience. And she's driven by her passion for creating an environment focused on wellness and optimal health. Karyn has founded Pro Health Physical Therapy and Pilates Studio in 2005, and she has just a lot to offer. In addition to being a physical therapist, she specializes in pelvic floor therapy. So we are really interested in that because we don't know a lot about it. So
And we're
welcome,
at least
Karyn.
some of us are in it. So
Yes.
Yeah. And I'm right there with you. I'm definitely in
Oh
that
my-
middle ages. So fit in the same,
Yes.
fit in the crowd.
Oh,
Yeah.
I mean, it's an unfortunate, well, I mean, it's a fun crowd, but
Yes.
when we talked about, potty training when we were younger and now we're having to potty train when we're older. So talk us through, like, we need all of the information to,
How do you potty train the
do?
adults?
yeah, how do you potty train us?
Yes.
Well, so the first thing that I like to say to people is just to explain, like, even what the pelvic floor, like, what is it? Like, what's the anatomy? Where is it? Because literally all humans have it. The idea here is that when somebody comes in and they've been experiencing leakage or they're having pain during intercourse or other things, there's a lot that goes on in the whole area coming from both your breathing diaphragm down to the pelvic floor. But specifically the pelvic floor, it goes from your pubic bone to your tailbone and to either bone that you sit on. So it sits in this area kind of like a hammock. So it's in the opposite shape. So those, Lisa being a singer, very familiar with the diaphragm, but looking at, it's the same shape, it's just facing the other way. So the breathing diaphragm sits in your rib cage like an umbrella, and your pelvic floor is an upside down umbrella. And so the two have to be able to work together. And what I find is that a lot of people start to think, well, I'm not really sure how I could even find it. So just if everybody's sitting and not driving in their car doing this, so just to kind of feel what is even happening in that pelvic floor, if you take your hand and place it on your sacrum. So the sacrum is that triangle bone at the base of your spine. And then, ladies, you can join in. You can,
No, hold on.
and then go
Okay,
ahead.
I was like, all right, can we do that?
Take your middle finger. This is not a bad thing, but take
We
your
are
middle
live.
finger and wiggle. I know, wiggle it
Because
in
we've got that
between.
question coming too.
Yes, wiggle it in between so you feel your tailbone. So you're kind of going
Yes.
down the crease in between. Okay, so you want to kind of have that finger kind of curved underneath. So, ladies, I give a different cue for men, but for ladies, put your mind's eye where your vaginal opening is.
Okay.
And your vaginal opening, think of it like your mouth. So
Okay.
the mouth is a little bit open. So you want to think of closing it and draw it up and in. And then release. And what you should feel is you may feel the release more than you felt the tightening. So if
Okay.
you think as you
Okay.
kind of pull in, you'll feel your finger like it's like your tailbone gently kind of curls under, kind of pulls away
Yeah.
from your finger a little bit. And
Yep.
then when you release, then you kind of feel it come back. So that's your pelvic floor. That's a pelvic floor contraction. So what
Oh my
happens is sometimes
gosh.
about 40% of people do that contraction wrong. So they push out instead of pull up. And so the biggest challenge is to kind of make sure that we get that balance in that pelvic floor first, but then there's the other parts in that center unit of your body that you want to be able to balance out as well. But just to kind of start out, like, what even is the pelvic floor? It's these
Right.
muscles that attach to bones that actually don't even move. So the tailbone has that little bit of movement, but if you think of all the other muscles in the body, bones move. And so you can think of, if you're doing an elbow bend and straighten, you can think, okay, I've got to move my biceps or another muscle, the brachialis. I've got to move those. But the pelvic floor is different because you're lifting tissue up and away and creating this hammock lift. in that area.
So what causes that as we get older, like for that to change? Like, I know like we talk about, when we laugh and when we sneeze and all that stuff, that wasn't, that didn't happen to us when we were younger or whatever.
Right.
So like what causes this lovely change?
So truly, as some of the episodes had said earlier, hormones are a big thing. I mean, the change in hormones, the decrease in estrogen has an effect throughout the entire body. It's another reason why during this time period that a lot of women will experience muscle pain and joint aches, because there's estrogen receptors throughout the entire body. So as those estrogen levels change, you can have these other symptoms that come up. And one of which is that pelvic floor isn't quite as strong as it once was. And so there's an element, you don't use it, you lose it. So in general, if you're doing fine, meaning, okay, I'm walking around and I'm not peeing all the time, your pelvic floor is doing most of its job. But when you cough or you sneeze, what happens is pressure increases in your abdominal cavity. And with that pressure increasing, things have to change. So meaning that the abdominal muscles have to be able to engage, the pelvic floor has to be able to engage. You've got to be able to have this balance. And what happens sometimes as we get older, those trunk core muscles, they get weaker, whether it's because of postural changes, less activity, changing other things, weight change, because if you change in weight, and one common thing in menopausal, perimenopausal time is to gain weight around the middle, as we've had some discussions on other podcasts. So you gain weight there, those muscles in that abdominal area stretch, similar to some degree, not the same, but to some degree like they stretch during pregnancy. But in this case, it's stretching and there's other tissue that's stretching it. And so we need to be able to maintain that support. And so this inner part of the body is a canister. So if you think of an image like a soda can, the top of the can and the bottom of the can are the strongest. And then you've got this nice tension around the middle part. Well, when you release and open up the soda can, that's kind of like breathing for the diaphragm, that pressure changes. Well, imagine instead of taking that release, you're just pushing more on the can. So then that middle has to be able to expand. And if it can't handle it very well, then unfortunately something might leak out because the floor part is like, I tried as much as I could. But
Right.
I can't hold it all.
I know.
I can't do all the work. I need my friends.
We're all falling apart. Yeah, all the friends are falling apart.
Yeah. So Karyn, does it work the same way then for men, or is it just something that doesn't affect men? It just doesn't work the same way.
It does in some ways, but the interesting thing for men is they generally have a prostate. So what happens in men when they have to have a prostate surgery, removal because of cancer? That's when they generally experience leakage. What's interesting is men will not tolerate it. Once they start leaking, they're going to start to figure out, what can I do to stop this? I don't want to wear a pad. This is embarrassing. I don't want to do any of that. Women, it's like, oh, I had a kid. Oh, this happened. Oh, it's okay. My mom did too. It's not a big deal. But what happens is if it keeps going at a little pace, then all of a sudden it's like, oh, that happens like once a year if I laugh really, really hard and I haven't gone to the bathroom in time. And then all of a sudden it's like, okay, it's like once a month. And then it starts to become almost every day. And it's like, oh, fine, I just need to wear a panty liner. But then that panty liner gets bigger and bigger, and that's more of a problem. Now that's a bigger issue, and then now it's a bigger issue to solve. So the sooner we can get in and have things to be able to address it, the better, because then it starts to go through, as you had Tracy on earlier in episode 5, talking about all the vaginal rejuvenation and other things that can be done. But she even mentioned the pelvic health PT. If that component can happen first to some degree or in partnership, it helps in the long range to not have other things down the line, which can be really problematic, where it's pelvic organ prolapse, where now the organs, instead of staying where they're supposed to be, they're actually falling down or out.
Lord.
Which
So
is
how do you know when someone can just do the PT versus doing something medical or doing a sling or things like that? How do you get to the point where okay, this will really help this person?
I always tell people it's the best first line of defense. So let's just say if you need to have surgery, no matter what surgery you would have in your body, the stronger you are going in, the better your outcome. So in that, if somebody's like, well, I have, there's different stages to pelvic organ prolapse. Let's say somebody's like, I've got a stage 2 and the doctor thinks that I might need to have surgery. if everything can get stronger beforehand, then it makes the post-operative recovery so much better.
That makes sense.
So the goal would be to take something from a certain stage to at least go back a stage, from stage 2 to stage 1. But if we're already in a stage 4, that means things are actually coming out of the vaginal canal. There's actually somebody's feeling something. That's definitely much more of a severe
my
issue
gosh.
that needs to
Right.
be addressed.
Wow.
That's
Makes
ooh,
sense.
Ow.
So
I
what are
know,
some of
like,
the signs that
ugh.
typically bring people in? I mean, we know, peeing when you sneeze and leakage,
Mhm.
but what are some of the other things that people need to look for that maybe they need to come in and look at
Mhm.
pelvic floor therapy?
So the earlier and something, so generally, and I'm a big proponent of somebody after they've had a baby to go ahead and within that first 6 to 8 week time frame as you're recovering and being a new mom to kind of have that, which I've seen that more. I feel like the younger moms are really addressing that sooner. It's something that's talked about more. But
Mhm.
then as somebody has gone on longer and it's like, oh, it's something I've had, the sooner the better at any time. So it's one of those, if you're somebody that, every time you get in the driveway, you've driven home from running errands and you come in the driveway and you're like, oh my goodness, I am not going to make it inside the house. I'm going to pee my pants. There's definitely breathing techniques and other things to help with that urgency. So these are individuals that maybe not leaking when they cough or sneeze, but they're leaking because they feel that desire, that need to go to the bathroom. So kind of working on some techniques to be able to help calm that down. But the difference is anytime you're leaking urine, the bottom line, it's never normal. It's never
Okay.
normal.
Mhm.
Isn't it
So
crazy?
just
Like,
knowing that part.
Yeah.
I never knew about this when I
No.
had the kids. I mean, I was 25 and 28, like we were talking about. Like,
Mhm.
I never, like, this was never
Mm-mm.
discussed. Like, I only heard about it when I got older because, I mean, you get to your 40s and now 51 or whatever. And now it's things that people are talking about a little bit more. But I think that's amazing that, like you were talking about, like now younger women are
Yeah.
discussing it or being not, they're knowledgeable about it. Cause again, guys, I was never told about this.
Mm-mm.
My
And I
mom
think that's a
told me
big
when I
draw
was
of social media. Yeah. I
yes.
mean, social media has definitely helped to put the word out for some
Mhm.
things.
Yeah, like, no, I think again, like you were saying, like it's better to be proactive than reactive
Mhm.
because
Mhm.
I'm now reactive. I'm like,
Right.
okay. But when it came up for discussion, it was like, oh, well, it's because you're older and your body is just like
Mhm.
on
Mhm.
vacation permanently. It's just
This is
check.
just something I definitely would have done after baby's had. I've known about it
Oh
because
my,
Same.
it's always better.
I did know about it. I definitely need, like, I
How
remember
did
my
you?
mom telling me, my mom had my
Oh, wow.
sister, she's 8 years younger than me. So I remember my mom after her doing all those, those
Right.
books you used to get after you had a baby years ago that would show you all the exercises to
yeah.
do to get rid of your baby tummy and everything. But I always remember her telling me to do my pelvic floor exercises. So I did them from a really young age and then just felt like I'd failed everybody when I
See,
pee my
that's-
pants, when I'd sneeze, because I was like, I did everything right.
See,
And I used my pelvic floor
Wow.
all the
okay,
time.
that's absolutely amazing. Because no, I
No,
mean,
it was really
we
something
didn't talk
that
about it at all.
Mm-mm.
And I mean, and I
definitely
didn't
knew.
have. I mean, maybe we would have talked about it if I did, have a little accident when I sneezed or I
Yeah.
laughed or whatever. But no, I mean, it like that's why when I got older, I was like, what? On top of everything else that
Why
is
this?
changing in your body, now we have to like go back to potty
Mhm.
training. Like this is
Yeah.
insane. So I think
Well, and
it's fantastic that people, that women are just being proactive at a younger age. So
So I had
and some of
heard,
it is okay.
sorry, Karen.
Good,
I'd
good.
heard that years ago, and I think this theory has been totally debunked. But you can, when you were peeing, when we were younger, they used to say stop and start your pee to
Ah.
strengthen your pelvic muscle. But I believe that theory is absolutely wrong.
Yeah, the wrongness of it is because there's a sphincter at the base of your bladder
Yeah.
that's not under your voluntary control. So it listens to the bladder above and the pelvic floor below. And so if you're peeing when the pelvic floor muscles are actually stretched and everything's supposed to be relaxed, and then you all of a sudden stop, that sphincter's like, oh, we're done. Okay. And
Ah.
then you try to start again. And then it's also a very challenging position for the muscles. So it's not a
Mhm.
great place to practice because you're really making it practice at its like most intense part. So as women, our urethra are 4 inches long. So gravity really helps a lot to get the urine out. Men have the prostate because the urethra is 11 inches long or so. And so they need that prostate to help pump it out. And that's the problem when there's a prostatectomy is that they don't have that anymore. So there's some elements of having some of that urine sitting in the tube for longer and other things that that the pelvic floor now has to play a much stronger role than they didn't have before.
Wow. That makes sense.
That's just
Do
crazy.
you think with Kegels stress me out too? I don't think I'm like do them right. Do most people not do them correctly?
So about 40% of people don't do them correctly. But when I just did that, so the pelvic floor contraction is called a Kegel, and it's named after a doctor, Dr. Arnold Kegel, because back in the 70s, he was like, this is the cure for urinary incontinence. Do Kegels, do 150 of them a day. It's not the cure because you can actually overwork the pelvic floor and make it so tight that you will still leak. So there are marathon runners that have super strong pelvic floors, but they leak because they lack that ability to have that balance between the breathing diaphragm, the abdominals, the back muscles, and the pelvic floor. So it is important to know if you're doing it correctly. It is a lift up and in, not a push out. And then if somebody's breathing from their chest and they're doing something all from their chest, they're not actually getting that good breathing element from the breathing diaphragm. So like I said, you've got these two kind of umbrellas sitting, and as you breathe in, the pelvic floor has to stiffen to prevent those abdominal organs and the pelvic organs from falling out of the body as well. But you have that stiffness around the middle that has to help as well. So being able to balance everything on out.
Oh my gosh.
Lisa, you should be really well balanced because you have a really good diaphragm and
I
you've been
know.
working
No,
on
honestly,
your
I know it's
Kegels.
funny that I'm going to ruin a song for everybody right now when I tell you this story.
Oh,
Oh, no.
all right, we're ready.
So-
Do we need to take a drink
Yeah,
first? Like,
seriously.
okay, are we ready?
So probably one of the most famous songs that we did in Celtic Woman is a song called "You Raise Me Up."
Oh,
So when we were on tour, we would have a live band on tour and we'd be singing live with the band. But because a lot of the backing track is orchestral, they're obviously not with us on tour. So you have a backing track which is live,
I
and
know
there's
where
a
this is
thing.
going.
There's a thing called a click track, and the click track keeps the live musicians, the live singers, in time with the tracked
okay.
orchestra. So years ago, she'll kill me. Chloe, when Chloe was really young, she was about 18 or 19. We had this conversation in the dressing room about, your pelvic floor exercises. And obviously we were always trying to keep Chloe, up to date with everything. We were all older. So I was like, listen, this is what you're going to do. In the middle of You Raise Me Up, we have a click track that clicks every couple of seconds. Every time it clicks, you're going to do your pelvic floor exercises.
Oh.
And I used to tell her, you couldn't tell, but you were doing it anyway, because you had this big ball gown on.
Right.
But I used to stand directly behind her. And we'd come off after the song and I went, you didn't do those properly.
Oh, poor girl. All right, so you're
Oh,
actually
God.
right. I will not ever
Yeah,
be
but
able to
yeah,
watch a video of you.
honestly, singing.
You'll see her get up and
Yeah,
down
you
a
can
little
see her
bit.
get up and down.
I would feel, now I'm going to be focused on Chloe. Going, I know what
Exactly.
she's doing.
And
I
she's not
know.
doing it right.
Yeah.
She's going to kill me. But yeah, no, that honestly, through singing, you have to use your pelvic floor
Right.
muscle so much when you sing in conjunction with your diaphragm. But it's just amazing that, like, I didn't know that either until I had to
That's
teach.
just-
And you have to think about what your body actually is, and your body does it naturally. That's the crazy thing, is your body actually does it naturally without you thinking about it. But it's just, you don't realize you're doing it.
And
See,
what
Ashley
happens
and I
is
can't
when you have
sing.
oh good, go ahead.
I was going to say, Ashley and I can't sing. And so that's probably why
I'm
we're having
sorry.
issues.
Lisa now has made me a believer that yes, we can. So I feel like,
Correct.
Yes.
yeah, just put me in a ball gown and raise
hope
me
for
up
everybody.
and just here we go. That might actually help my pelvic
Yeah,
floor.
there you go.
Exactly.
Okay, we pivoted on that one for a little bit.
All good.
Yeah.
So go on, Trisha, ask your question.
Okay.
Well, we'll get to that question.
Oh.
So I have one question before that question. So I've been told I have piriformis syndrome. We're joking. That's the only part of my butt that's tight. But I've read that has to do sometimes with pelvic floor issues as well. Is that correct?
It can be. And so when I'm not a big proponent of saying like one muscle is a problem, usually it's because there's multiple things, kind of multiple layers. And so when somebody says, oh, your piriformis is always tight, I want to go back and kind of figure out like, well, why is it tight? Muscles aren't super smart. The nerves tell them to tighten and they tighten. That's about it. They don't do anything on their own. And so there's a reason why it's tight. So there's something that's driving it. So whether it's the pelvic floor is tight, and so those hip rotators, one of which is the piriformis, ends up being tight, or it's something coming from higher up in the back area, or something else that there's some movement dysfunction in the hip. So there's lots of things in this whole region to kind of look at all of the skeletal and muscular things that line up in that area.
So to make appointments with you, I'm ready to schedule.
I am too. Like
Do you
tomorrow.
have to, do you typically, and do most physical therapists, do they need referrals? I know everyone's different, but like, do you need a referral or can you just schedule with you?
So it depends on the state that you're in. So many states in the United States allow for at least an initial evaluation with a physical therapist without a referral.
Okay.
Georgia's State Practice Act, you can actually come for 8 visits before you need that referral. So, and the only insurance that requires a referral, you have to, no matter what state you're in, is if somebody has Medicare. So if Medicare is their primary, so that wouldn't really be somebody in middle ages necessarily, but just kind of looking at all ages,
Right.
listening to online, but knowing that we have that balance from there. But you can come in Georgia for 8 visits without a referral.
Well, what does that evaluation look like?
So
That's a
this,
good question.
yes.
Yeah. Because again, I'm going to come see you tomorrow. So,
so there's just stop on by. So the first thing is just kind of getting the background. It starts as a conversation. So generally for a new patient, I'm spending an hour to 45 minutes with that person, kind of going through, when did this start? What's going on and what's happening to your body, and looking at all the things. And I just want to hear it all. And then I'm asking questions. So how many times do you go to the bathroom during the day? How many times do you go during the nighttime? How many times are you waking up specifically to go to the bathroom? How are your bowel movements? Do you have pain during intercourse? Do you still have a menstrual cycle? What do you use for hygiene? All of those kind of specific things. And then the next part goes through, let's look at how do you check the body out. So I'm looking at, how does your spine move? How do your hips move? What's the strength of your abdominal muscles, your back, your hip? I'm just trying to clear out to see what other components are part of this.
Right.
If somebody's having pain, knowing that as a physical therapist, I do some manual therapy on muscles. There is a next step to kind of look at, okay, are these muscles painful? So looking at an internal assessment, and again, getting clearance from the patient, and knowing that, just to kind of see how the muscles are. The interesting thing on the pelvic floor, so if you look at your finger and you bend your index finger at the first really big knuckle, not the little one at the very end, but the first big knuckle, from the tip of your finger to that knuckle, that's the length of your pelvic floor muscles. That's how far up in that vaginal canal they go. The rest of the vaginal canal, because most of you are going to be thinking, oh yeah, well, it's higher than that. It goes up further. That's mucosal lining, just like the inside of your mouth. So it's a self-cleaning oven. So the pelvic floor is really at the bottom part, but it's pretty deep. There's 3 layers of muscles there. And so that's what we're kind of working on. So you can't really get the gist of how well the muscles are working. There's some of it that are still further in that canal to be able to assess in that way. And then from there, I always give homework. As a physical therapist, you're always going to leave with some level of homework, but I'm always cognizant to know, how can I link it to things that you're doing during the day? Because sometimes there's things that happen that it's based on positionings you put yourself in that you don't know that you are. For instance, if you stand and you always stand and put your weight on one leg, you're always leaning to one side. There's going to be one side of your pelvic floor that's going to be working better than the other side because you're putting weight over there. If you stand and you have a really long curve in your back, like the curve goes up towards your shoulder blades, it's going to make your abdominal muscles weaker because they're stretched out. You're not having that good balance. So there's that balance in there.
Like, this is just,
It's crazy how it all goes hand in hand.
Oh my
together.
gosh. I mean,
Yes.
Again, I learned so much from each of our podcasts. And Lord knows I'm not a doctor, but like, it is like, I wouldn't have thought that obviously the body is connected, and don't get me wrong, but
we all know the song. Foot bone's connected to the ankle bone, right?
Exactly. But just like, now the
balance.
the balance of it
It's interesting.
is just,
And it is amazing, like these muscles in the core of your body. If we want to talk about like from your shoulders to your hips, as a Pilates teacher as well, that's what we're working on all the time, kind of having all of that. But the idea is that this core of the body has to be able to function well, and things should do their job without you having to think so hard about it. I mean, thinking about, when you're younger, you never really thought about, oh, I need to go to the bathroom. Like when you thought about it, you thought about it. Not too young, because then you're too busy doing something and don't want to take the time to go to the bathroom. But the idea that being able to know that these things function without you thinking so hard about it. And that's what our body is designed to do. It wants to do the least amount of effort to do the task. And if things are lined up well and they're functioning well, that's what's going to happen. when there's injury, when there's trauma, like a vaginal delivery, or even a C-section. And I think that's kind of mistaken sometimes when people have a C-section. They're like, oh, good, my pelvic floor will be fine. But there's still an imbalance in this whole core system because those muscles had to be cut. It is major abdominal surgery.
Right.
And if anybody had a abdominal surgery for any other reason, most of the time they'd be said, you cannot lift more than 8 pounds for the next 6 months.
Right.
But hey, you had a C-section, next day, here's your 8-pound baby. That's just going to get bigger as you go.
Right.
Right.
Yeah.
That's crazy, actually. That's really
That's
insane.
true, though. Very true.
So I know like each person is individual, but like what do you see as far as like time frame of therapy and the length of it, like when someone could start to see improvement? Now, again, I know that it depends on the severity and situations, but for the most part, does your patients all see improvement? And like, is it a 6 month? Is it a 3 month? Is it a 12 month? You know, what's a typical timeline?
Yeah, generally in 4 to 6 weeks. If
my
you're doing your homework and you're doing the things you need to do,
oh my God, I'm coming
then
to
it's
see you
within 4
tomorrow.
to 6 weeks.
This is amazing.
That
I'm coming.
80% of people are going to see significant improvement in that short period of time. And they should. And if they don't see that improvement, then there's something that now we need to go ahead and get some other medical providers. It's outside of my scope at that point and being able to go through. So, and you know, my big thing, you know, as people come to see me, it is a partnership. I want you to be better. I always want my patients and people to feel better. But if they're not putting in the effort, you know, we got to meet, in the middle. Both of us have to do our part in that way, right?
No, absolutely. But that's so encouraging because obviously I
thought it would be longer too. Yeah. That's great. 4 to 6 weeks.
You know, and it's amazing how some people that they, just a few weeks ago had a patient come in and she's been having, urgent incontinence. So where she gets that feeling, I have to go to the bathroom so bad, I'm going to pee my pants, and starts peeing before she gets to the bathroom. And within 2 weeks, just by doing some of the techniques I told her, she's like, I don't do that anymore. It doesn't happen.
That is fantastic.
And so it's just kind of getting into and last week, 2 weeks ago, you all talked about like the mind, body, the spiritual connection as well. And there is so much of that connection of how your mind works and your body, and how can you find that connection to be able to kind of put everything together.
That's crazy. I was listening to a girl on a podcast the other day who was talking about the urge to pee when you're in the shower and how bad it is for you to give in to that urge. Is that true?
It is true, because then all of a sudden your brain will link hearing water to having to pee. So whatever your brain links together, so whatever wired together fires together per se. And in that case, it's like if you give into it, that means anytime you go to wash dishes or wash your hands, that it might, your body will think, ooh, I got to pee. It linked it together as a occurrence.
That's psychological too. It's almost like if I have a car accident and it's raining, then I think every time it rains,
you're going to crash your
right.
car.
So then people won't get in their car. So it's a whole psychological, that makes a lot of sense.
That's crazy.
So if someone does the exercises and they do better in 4 to 6 weeks, do they continue for the rest of their lives? Do they have to just keep doing it every so often?
So generally what I'll say, and I like to have people do it every so often, because it's this, some of them can be habits that you have to create those new habits. So it takes that period of time to create those new postural habits, those new movement patterns. So it's good to have those foundational exercises that literally take anywhere from 3 to 5 minutes. Not really long. It's just part of your routine. And so it's just like with anything, sometimes you just have to do your prep work to be able to have everything else go better. And that's what a lot of these exercises are, just very much foundational prep work.
For our listeners that are on right now, we're new to the live, and I just noticed in the chat that you were asking if you can ask questions. So feel free to ask questions, and I'll pay better attention to the chat we've got going on.
Because we've all just kind of like asked all of our questions.
It's just fascinating, though.
Amazing.
It's like, it's fascinating. Do you feel that people have gotten better about coming to you for things like this? Because to be honest, I would never have thought to go to a physical therapist.
Oh,
because I would have
absolutely.
assumed you just go to your gynecologist.
Yeah. So yes and no. So I would say yes and no, because even some of the gynecologists don't even offer it. They don't even say, I will give you a referral to physical therapy, because just like you said, they'll go to their gynecologist and they'll be asked the question and they're like, you know what, I'm going to answer yes this time. I'm going to be honest and say, yeah, that's happening. And they're like, oh, well, here's some creams, or here's this. And, let's just revisit this instead of, saying, and what I've noticed is some of the older, like when I say an older mom, like maybe their daughter has had their first child and is really keen about pelvic floor health. And the mom's like, well, I still leak when I sneeze. She's like, oh, you shouldn't do that. And then they're coming in saying, well, my daughter said I wasn't supposed to do this. So
Yeah.
I don't know really why I'm really here with you. But then we explain, let's work on the muscles and all of that. And they were surprised because again, they thought, oh, well, I just have to live with this. My mom
Yeah.
had this happen.
Right.
That it's
Just
definitely a
part of getting
common issue.
older. Yeah.
Mhm.
What's your thoughts about some of the new procedures and things that are out there, like the Mona Lisa and the things that people can do for like tightening or rejuvenation? Does that help and go along with it, or is it a completely different thing?
I look at it on a spectrum, so it's some things that some people need to have based on lots of different things that, they've had a little more trauma, things are a little bit more stretched, the tissue as the decrease in estrogen and the change in the collagen, it affects people differently. So that's, where that gamut of everything. It can get with the Mona Lisa at times, and I've seen this with some patients, it gets too tight. So now that person went to get this procedure to be able to help tighten things up, and then it went a little too far. And now they're having pain during intercourse, or they're having difficulty fully releasing their bowels because things are too tight. So we need to kind of work on the opposite and make sure that things are stretching. So with any procedure, there's always risks and benefits. And so it's being able to know what's best in your body in that way.
It
And
seems
again,
like PT is the good thing to start with first, because
Yes,
obviously like it's
yes.
the least invasive, and it's something that, try in 4 to 6 weeks and see if that makes improvement.
Yes,
for
it's not a
those of us who
huge time commitment. Yeah. go
Those
ahead,
of
Liz.
us who don't know, what's the Mona Lisa?
Thank you, because I
I
was
didn't
just
know.
sitting
I
here
don't know
going
what
like,
it is.
There's several new procedures out there that they're more about like tightening things. And Karyn, you could probably say more than me, but it's really about, there's different things now that they're doing, like they're the heat wave type kind of
Isn't there like
therapies,
a
and like
A lot
little,
of them are like radio frequency.
radio
Okay.
frequency.
and there's
So
some, that
but
goes.
I think that sometimes, I mean, even as a psychologist, I think people want the quick fix. Like they'd
Yeah.
rather take a pill than do the
Oh, yeah.
work. And I think what Karyn is saying, and I totally agree, is like, try this first, do the work, if really try and do your best. And then if that's not working, then look at other kind of
You don't
procedures,
have to jump.
because
You don't have to jump.
right.
Leapfrog over.
Right. Because if you do what she's saying, exactly the physical therapy, you're
Right.
not going to get to the point where, you can't have intercourse because things are, you know what I mean?
Yeah.
That too tight that it's like hurting you. So I think it's starting with that if you're willing to put in the work, but then there's other things that you can go to that probably are after that. And then the sling would be kind of like way down the road, hopefully.
I think that's just with all medicine. I mean, my husband, foot and ankle surgeon, he's always going to have you do non-invasive modalities
Right.
before he's going to jump
Right.
into surgery. So I think that's just
But I think what Karyn says, right, you have to really put the energy and the effort into it. So there are people who will go home and do the homework and take it.
The work.
And there are people who are just like, nope, I just
Yeah,
want you to
just-
wave your magic wand.
just
like,
put
fix
me under
everything.
and do whatever you need to do.
Exactly.
And
But I think as well, though, when it comes to female health as well, I know I've had this conversation with Karyn before, and we had this conversation with Dr. Tracy as well. Like, you don't know what's normal because most of us haven't seen another vagina. So
true.
you don't know whether you're normal
And
or
that's-
what's happening to you.
and that is
normal.
actually not something that I think that we talk over
No.
book
No.
club or bunko or
No.
wine night. You're not going to be like, we talk,
We
like,
still haven't got to that stage. I definitely haven't. I still haven't got to
Oh,
that
yeah,
stage.
no.
And I'm open. I'll talk about anything anyone wants
Yeah,
to talk
I
about.
That's why this is so good,
But
because
it's-
we can
yeah.
talk about it.
Because
Yeah.
you just don't know whether yours is normal or not.
oh my gosh, I can't.
Well, there is an artist that did a whole wall. She
Oh
did
my-
plaster casts of vulvas, did a whole wall of them to show that there's a distinct variety of vulvas.
Yeah.
So that was her whole art installation. So it's Jamie McCartney. So it's called The
Interesting.
Great Wall of Vulva.
oh my god, I can't.
I have never
I
seen
love
that
it.
on HGTV ever.
I-
Karen
look
sent
that
it to me. I
up.
have it. I'll
I
send it to you.
do.
all, Yes.
Shut up. I think
Oh
I'm
my
just of the
gosh.
mindset that
Yes.
mine's fine. It's
But
fine.
yeah, but
I mean,
I know that, but like it
I
is,
know.
it's so important. It's so important. I mean, I know Tracy was saying, you should look at your own. And I remember seeing that in books when you're growing up. You should look at your own. I was like, I do not want to see that. Thanks very much.
No.
I mean, I'm kind of
Good.
still of that mindset.
Oh,
I
I'm
mean,
still of
and
that mindset too.
I
Yep.
mean,
Yeah,
I
nope.
just am. Yeah.
Which you
So-
shouldn't be.
We had a question come through. We've got, listeners from all over, some far away that cannot see Karyn. Is there a book that you recommend that goes over some of this information? Is there a book in particular that you recommend?
So there are a few books out there, but they tend to be a little more medical, like very much for the practitioner. I actually have an online course, and I call it The Power of Your Flower, that I go over a
Oh my
lot of these
gosh.
other things that
I
just talk
love
about
it.
different exercises that are just beyond, that's just beyond Kegels. It's not just Kegels. That actually, when I went to my first continuing education course, when so graduated PT school in 1998, and I went to my first continuing ed in pelvic health in 99. And it was called Beyond Kegels. That practitioner that was teaching, she worked with Dr. Arnold Kegel, and she's like, he's not got it all. But so taking a lot of that and different people I've worked with over the last 25 years, and just taking that information, but to put in. So I have a website, drkarynstaples.com, and it's called The Power of Your Flower. There's some other courses on there, but I recommend that in that way because I go through a lot of different things there. And that just is a great place to start on that.
I
That's
love the name,
amazing.
but we will definitely
Yeah.
post that link when we post
Yeah,
this
no, that's
podcast too.
fantastic.
And knowing
Yeah.
Karyn, this will probably be the most thorough thing you have ever seen. There is nobody I know who works harder than this woman. She's
Mhm.
incredible.
She's
She's
amazing.
absolutely incredible.
Mhm.
We had another question come through as well. Let me see here. Does avoiding alcohol and carbonated beverages help with leakage?
Do not say yes.
I was like, hold on a second.
Man.
No, can we still just
Can we
say
stop
frozen
that?
water is fine? Please,
So
please,
it
please, please.
depends on why somebody's leaking. So if it's due to urgency, where somebody has a lot of urgency to go to the bathroom, then the answer is yes. So there's things that we can ingest that are considered bladder irritants. Caffeine, that includes chocolate,
Oh,
alcohol,
oh,
Please.
Karyn.
spicy foods, and citrus. So they're all irritants. So the point would be to, if you have a little bit of something, you have some things, but if something
Right.
is, if your bladder is irritated, we kind of need to pull back and kind of get a little reset, and then you can slowly add things in. It's just the same as doing an elimination diet that you might if you're having some GI distress. So being able to have that, but yes, it can help. But if it's stress incontinence, like from leakage, from sneezing, coughing, those aren't really the issues. It's not coming from a bladder irritant. Now it's coming from a postural balance of this intra-abdominal pressure in this center
Mhm.
system
Mhm.
from there.
Yeah, I think it's so important too because just like you said, and I think someone Tracy said before is like you can do these exercises wrong, so it's important to have someone kind of guide you through
Yeah.
that
Oh my
because
God, because that
I
would
would
be
hate to
me. I
think
would
yes,
totally
I'm doing the
be off the
wrong thing and
charts
it's not
and
helping at all. So
all of a sudden I can
It's-
sing.
no,
I
exactly.
dread to think what you'd be doing.
I might tinkle when I sneeze, but now I can sing.
Yes,
I'm sorry.
we digress.
It's amazing. The one thing it's on this, it's like, it's an amazing thing to think of how much the incontinence industry has on advertisements to make the products that they have look more appealing for people to use. So
Right.
again, having that versus, in my opinion, is like, okay, that's great. And that's something to be able to utilize at a time, but let's do some other things and see, can we make that
Mhm.
We
better
sell it.
rather than having
Yes.
to go to that. It's unfortunate that many times as people care for their aging adulting parents, that at some point, that's usually the reason when they have to start changing their adult parents' diapers. That's usually where they draw the line, and they need to be able to put them into a facility or something. So the goal is that we want to keep as continent as possible for as long as possible, so our children do not need to put us in a
Oh my
skilled nursing
gosh.
facility.
Yeah. That's sad.
Mhm.
Ooh,
Mhm.
yeah.
Very sad.
Yeah.
It's hard. It's hard at that point, at that, just different things to kind of deal with. So
Mhm.
we want to make sure that we can do everything we can for our own bodies
Yeah.
to keep ourselves living longer. And the things that help us to live longer are moving. That's the number one thing by
Mhm.
keeping our body active. It's the number one reason that people live longer better.
Mhm.
Is moving their bodies. And that includes being able to do things that, help to keep ourselves, all of our joints lubricated and muscles moving in that
Mhm.
way.
I think the main thing that you said there that resonates with me is just that is not normal. Like, because we talk about this as so
Right,
normal,
like-
but
Mhm.
my mom actually had a surgery and we're very, very close, but in January, and she had a very big, like tumor removed from her spine. And she was just like, yeah, I was having to go to the bathroom more and more and more. But just, as we get older, we just think that's kind of normal.
Yeah.
Right.
And so that's kind of how it started. And then there was pain, and then there was all these other things going on. And I think just if people don't hear anything, just knowing that that's not necessarily normal. We need to do things to kind of
Right.
help
Like ask
correct.
questions and like
Yes.
advocate for yourself.
Because you don't know. Like
yeah.
I would just think too, if I were her age, oh yeah, this is what happens. This is what we do. But it really
And
can
that's a
be
big deal.
problematic.
And it was a big deal having, that's a big thing, big finding, to kind of know that she just kind of was like, this is a big, so hopefully she's recovering well.
Oh yeah, and she's fine now, much better. But I mean, had she just kept going and they hadn't had the pain in her legs and things, she would have thought, oh, I'm just going to keep doing this.
So, I mean,
no idea.
That's what we've always been told. Oh, well, it just happens when you get older. I mean, everything, whether
Like,
it's your
just deal with
hips,
it.
your knees, it just happens when you get older.
Yeah, but knowing it's just not normal.
Right.
I think that's been a common theme, like two very common themes in most of our podcasts is one, just kind of accepting things as well. I'm middle aged now. This is just how it is, whether it's relationships, your body, different things happening. And the other common theme is being proactive with everything. Again, whether it's your body, relationships, anything, just being proactive with things before they are a 911 call.
Yeah. Well, I also think as women as well, you're programmed to look after everybody else first anyway, before it gets to you. And then you just, again, it's that, oh, well, I'm older and I'm female. And, and we're
great with excuses.
We really are.
Yes.
Yeah. Because you have to be.
I know. I mean, like,
because everyone else is priority.
Absolutely.
Well, I'm a mom of all boys, so I'm probably fast tracking it to the nursing home anyway. So
me
I really
too. All right, Trisha, it's gonna be me and you, babe.
So I really need to be working on my exercises to at least keep me continent for as long as I can be.
Oh my gosh, I can't even imagine my two boys. They would be like, "See ya." No.
Yeah. No thanks.
Yeah. Sorry, mom.
You're just gonna hope for really amazing daughter-in-laws.
Yes.
I know.
Correct.
Yes. That is what I'm moving towards. Absolutely.
Actually, my boys are pretty sweet boys. Hopefully, I'm not. Hopefully, at least they'll pay for a nice nursing home.
Well, that's my hope too. Because I mean, yes, the
good
boys
diapers.
yes.
Okay, we'll still
Good
be doing
diapers.
our podcast on a Wednesday.
Yeah.
And they
We're
loved
gonna-
it. So they're going to want to
We're gonna all be in the same place together.
Yes.
Can you even imagine?
With Karen.
I
Yes.
mean,
Let's take Karen with us.
Yes,
That would be fun.
Karen can be with us. We'll do old age-ish.
Old
Oh,
age. I mean,
Old
we're moving right on into
Freaking
the next podcast.
Yes.
Yeah, I'll be leading all the exercise classes to keep everybody
Oh
moving.
my gosh, that would be amazing.
Making sure everybody can stand up out of a chair without using their arms.
Exactly right.
Keeping their grip strength strong. That's another important thing as we age.
Yes.
Oh, I know. Oh,
So
Well,
Lisa
Karen,
had
you were-
asked.
Sorry, go ahead.
Oh, so I was just going to say, Lisa had asked one question before we had gotten on, and just the whole joint pain sort of thing. And I wanted to kind of circle back to that a little bit. I know I
that's a
kind of
big one
went to
too,
that.
yeah.
So just had the joint pains, and I just wanted to kind of put out some numbers, just so that way, again, people, there's some sense of normalcy, but there's also that sense of just realizing that there are things to be done. So 50% of women will experience joint and muscle pain going through perimenopause, menopause. So it's quite a big group of people. But the biggest things to help are movement. And what I find as women as we're coming into this stage, and I'm going to include myself, the things that you always did before don't seem to work anymore. Like the way you exercise, the way you moved your body, it's like either it doesn't feel good because it was high intensity before and a lot of heavy jumping or heavy weights or things like that. It's still important to do strength training, but it's also important to do some sort of what I like to put in a mindful movement practice, whether it's something like Tai Chi or yoga or Pilates, something that allows you to work on that mind-body connection and how am I lining my body up? How am I moving? And that also helps in that range of motion and in making sure you get that joint lubrication along with just getting your hydration, which links it back to the leakage issue, because a lot of people say, I don't want to drink more water because I'm going to pee more or I might pee on myself more. So being able to balance that out and knowing when you're hydrating and putting all that and knowing that's important for the rest of our skin and everything like that to stay. But that knowing everything kind of binds together, all the things that being able to move is really important.
Amazing.
That's great.
yeah. Because I mean, I know like knees and hips.
Yeah.
Like, what happened?
Yeah.
Yep.
True.
Full body thing.
Well, Karen, you are so incredibly
Oh my gosh,
knowledgeable.
yes.
This was
Yes.
amazing. I mean, there's so much information about our pelvic floor that I had no idea I needed to know.
There you go.
Yeah, but it's
Yeah.
hopeful, and I
Yeah.
think that's like the gift that you give is that it's hopeful.
Yep.
So,
And can be fixed.
Yes.
Yes.
So thank
Just have
you
to
for
put some
that.
effort
Yes.
in. You're welcome.
Yes.
And we will do that.
Thank you, Karen.
Thank
You're
you.
welcome.
Thank you so much for having me on. I appreciate it.
Thank
Appreciate
you.
it.
Thank you.
Bye-bye. Thank you, everyone, for tuning in, too, and
Yes,
for giving
thank
us your
you, guys.
questions. We'll get better at the chats and answering your questions. Have a great night, everyone.
Bye, guys.
Bye.
Thanks for
Bye.
listening.
Bye.